Hi everybody, my name is Mona Chiso. So today I'll be making the video for this week. So I'll be talking about one of the clinical encounters this week. So I'll be using it for my clinical journal. So I'll be talking about this lady, this 62-year-old lady that came in for medication management. Patient had ADHD. So she was on Adderall. So she came in for her to be for her to be to be assessed of this medication side effects and all that. So that was the reason for patient's admission. So talking about the implications for psych nurse health practitioner, the implication is that this scenario, this with this patient, I it made me understand that the role of the psych nurse health practitioner extends beyond medication management. It extends beyond prescription. So because during this course, the patient was also encouraged about lifestyle. We like I gave her education regarding her lifestyle, her ability to like integrate her activities, things like that. So to the best of my knowledge, my role is gonna like extend beyond medication management and prescription. The insights into psychopathology is that previously I used to think that ADHD is more common in children or people like yes, children or adolescents. But with this lady, I realized that ADHD can persist and get into adulthood because this lady is 62 years old. She's still suffering from ADHD. So to in summary, ADHD is not just present in children. It also can be found in adults. So talking about the provider-patient relationship. So during the course of seeing this patient, I used active listening. I made sure I paid more attention rather than talking too much. So she was very comfortable telling me everything she wanted to tell me. I also used like positive reinforcement to reinforce her positive behaviors, which she has mentioned. That made her feel free to tell me more things. I was also very empathic, trying to empathize with the patient. So this really made the patient to feel more relaxed, feel more supported, and also was able to tell me more information about her. Talking about my personal strengths and limitations, one of my personal strengths and limitation, like I said, is using positive reinforcing patients positively and also being very empathetic. So reinforcing positive behavior is a way of like encouraging patients to continue with what they are doing and also feel more relaxed with you. Like this kind with the case of this client, this patient, so she was really like she sticks to her medications. So I also reinforce, I tell her, I acknowledge, I appreciate the fact that you're taking your medications and things like that. So talking about like in summary, to summarize this, one of my strengths is positive reinforcement, active listening, and being empathic. So talking about the therapeutic use of self. So what I did was to encourage, what I did was to reinforce whatever patient was doing right. Right? So for this scenario, like I said, I tried as much as possible to encourage her to acknowledge the fact that she was keeping to her medication. I also acknowledged the fact that she was building like a social network of friends. So that was what I used with therapeutic use of self. So for specific learning and future application from this scenario, to the best of my knowledge, ADHD is not just common in children. It's in as much as it's common in children, but it can still occur in adulthood. This is something that I have to have at the back of my mind at all times. Also, I'm reflecting on the fact that my role extends beyond medication management. My role also goes into health promotion, trying to talk to the patient about good health behaviors. Also, I'm also reflecting on the therapeutic use of self, like reinforcing positive behaviors, so that that helps the patient, to have more confidence in themselves. And also, it also helps to build rapport. It helps the patient to feel comfortable talking to you, feel relaxed, especially whenever you acknowledge their positive behaviors. Thank you so much.